I'm the mascot for Peer Health Educators.
Awesome.
So what is ADAP?
The Alcohol Drug Awareness Program, also known as ADAP, is a component of health services, which is really charged with the prevention, education, intervention, treatment, and support and recovery for students on campus here. It's important to note that all students have access to ADAP, and that's regardless of whether or not a student uses a substance or not. Points of contact can actually be brief or ongoing. So for example, a student might just drop by and just want a handout on any long-term risk associated with alcohol use, or maybe a student's interested in finding out where the local AA meeting is compared to the college, right? Other instances would be ongoing, right? And so a student might be looking for individual counseling or maybe group support via the Connect the Dots group.
Isn't ADAP just for students who get in trouble or get ADAP'd?
No, actually I see plenty of students that come in here voluntarily. You know, I see students that either come in because they're worried about somebody else's use, or perhaps they had a bad night drinking and they just really want a safe space to really talk about that. I also see students that come in because maybe they're starting to question whether or not their use is of concern. And I obviously see students too that actually do identify with a substance use disorder and looking for treatment and support around that, as well as see students that identify to be in recovery and are looking for support and resources to maintain recovery. I'm also aware that many students might think I'm the enforcer, or ADAP is the enforcer of the Alcohol Drug Awareness Policy, and that's actually not true. I'm actually the referral source. So when students are mandated, I'm the one that they often will see. Most students that are mandated would say the sessions feel very educational. And the goal is really centered on really increasing their awareness about the risks associated with substance use and allowing them to develop some protective factors as well as harm reduction skills to help promote positive health and well-being.
If a student comes to ADAP, should they be concerned about confidentiality?
It's important to note that ADAP sessions are free and confidential, for one, okay? Second, confidentiality is of high importance, and the parameters of confidentiality are reviewed at the first point of contact. Third, it's important to note that students actually do have the ability to share information if they express the desire to, and they would simply sign a release, which would then specify a certain individual will have the ability to have some special information. And sometimes students find that really helpful.
Will they assume I have a drinking problem?
First of all, it's my experience that people use substances and don't use substances for a variety of different reasons. Second of all, as I mentioned before, I see all types of students. Some students are simply coming in because they're worried about somebody else's use. So their own use is not even a focus of the conversation. And third, not everybody's use is problematic.
Are you going to tell me to stop drinking or preach abstinence?
I'm well aware that many students assume that that's my agenda, but I'm not actually in the market of preaching abstinence. Although abstinence might be healthier for some people, not everybody's use is a problem. Instead, I center on the philosophy of harm reduction, which really is about recognizing people have the freedom to choose whether they want to use a substance or not. And second, it's all about providing education. And there's a continuum of use from safer use to managed use to abstinence. So really the focus is on prevention of harm instead of, or rather than prevention of use altogether.
Do I have to come to Safford Hall basement to make an appointment with you?
No, there's actually multiple ways in which you can get in touch with ADAP or myself. First of all, you can actually contact me directly at my email address at jbaloo@mtholyoke.edu. You can also get in touch with Karen Jacobus, the Health Education Coordinator, at kjacobus@mtholyoke.edu. You can also contact myself, the Director and Therapist, for appointments via the My Health Connection portal. The third option is actually contacting the ADAP line, which is 413-538-2616. It's important to note that when you call that number, you will be speaking to a health center administrative assistant who will then support you in either getting in contact with me or setting up those next appointments.